What's up, y'all? So before we get into the video of the things I've learned as a first-year dental hygienist, I just want to introduce myself. My name is Dennis Walker. I'm a licensed registered dental hygienist here in Atlanta, Georgia. I've been in dentistry since 2018, so that's going on 7 years for me. I'm gonna give you guys a little background about me and my career and how I started and how I ended up. So before I became a registered dental hygienist, I started off as an assistant. I did maybe 2.5 years of dental assisting, and I realized that it wasn't for me at all. I love dentistry, but I did not like dental assistant side, if that makes sense. So push come to shove, I ended up applying for dental hygiene school. I got in, I hung in there, I got through it, I got my license, and then here we are. So here are some of the things I've learned as a first year registered dental hygienist. So I wrote some things down because there's so many things I've learned and I don't want this video to be super duper long. So if I have to make part 2, guys, just let me know. These are some of the things I wish I knew. So one of the first things I've learned or came to the realization about as working as a first year dental hygienist is time management. You guys, when you get in the field and you're actively working a schedule, time management is so important. Now, there are going to be some things that are just out of your control, and that's okay. I had to learn that, you have to roll with the punches. So when I speak of time management, I'm talking about making sure that you get to work on time, making sure that your room is set up and ready to go, make sure you review your patient's chart. And when I say patient's chart, I mean medical history, dental history, all those things, medication, all that stuff is important, okay? It's still important. It was important in school and it's important in the field, okay? And honestly, the part that can kind of get irritating when it comes to time management is when it's something that's out of your control. So when I mention out of your control, that goes to the patients not being here on time. The front desk may allow patients to come back late, and then now you have to rush because you have another appointment scheduled right after that you don't want to be late for, because you don't want to. My whole thing with that is you don't want. My pet peeve when working my schedule, if somebody is late, I don't like to see them because we give you a 15-minute grace period. And realistically speaking, if I accept you 15 minutes late, that means I'm getting started 15 to 20 minutes later than I'm supposed to. Because truth of the matter is, now I don't know how everybody's office is going to be set up. Some people have 30-minute appointments depending on what kind of clinic it is. Some people just have 60-minute appointments, no matter if it's a prophy, a perio maintenance, or a deep cleaning, Ideally, I want to say everybody has probably between 45 minutes to a 60-minute window to clean a patient. So think of it like this. If you have a patient who's scheduled to come in at 8 o'clock, they don't show up till 8:15, which is the cutoff, but they still accept them. So then let's say you have to take x-rays. So now you have to take x-rays on the patient. You have to ask the patient what's wrong, what's going on, are there any concerns? You have to then walk that patient to the room, go back to the x-ray room, clean that room. Like, there's so many little things that you have to factor into the time. Now, once you got the patient back into the room, you have to perio chart, go over the numbers with them, make sure they understand what's going on, ask if they have any questions to make sure that we're all on the same page during this appointment. Then you have to do the cleaning. Now, let's say that patient is due for a doctor's exam and the doctor's is busy and she or he can't get in that room to kind of save you time while you're doing other things. Then after the cleaning, you have to wait on the doctor. And then most of the times, if you guys kind of know or you have a background in dentistry before you became a dental hygienist or got into dental hygiene school, the doctors will definitely slow you down. Like, I love my doctors, they would slow you down because they got their own schedule and stuff going on too. But the difference between me and them, I don't have an assistant assigned to me. I pretty much do everything on my own. Now, do my assistants help me? They do, and I appreciate them for that, but ideally, I'm by myself most of the time. So by the time you do all of that and you have to still wait on the exam, you gotta think, okay, this patient is still in my chair, the doctor still has to come in, and I still have to flip this room and get it ready for the next patient. And God forbid that the next patient need x-rays. Like, I can go on and on and on and on and on. I promise you I can, but I say all that to say time management is very important. So this is how I do it. I try to get ahead of certain stuff. So like I said, if the patient is late, I put my foot down and I'm like, hey, I tell the girls up front, they're not here past 9:15, can't see them. I genuinely can't see them, because if the person after that is confirmed, they confirmed the appointment, they're coming. So 15-minute grace period, that's it for me, or whatever they allow you guys at your office or the office that you're working at. I try to put 2 trays in my room, so I have a tray on my counter and I also have a tray put away, so when I'm cleaning my room, I can just pull that tray out and have everything already in the room, so I'm not going in and out of the room, in and out of the room. I make sure my water is filled up in the morning when I get in. And by water, I mean the water that you use in the dental chair that you fill up. That's also first thing in the morning. I also try to go to at least the first 2 to 3 patients appointments to see what they need, what we're doing. So I kind of have an idea. You want to kind of have an idea of what you're doing. If you're just walking in blind, you're not going to have a good plan of what you need to do and how you need to execute that plan to get that patient taken care of. You want that patient to be seen and heard. And you also want to get them in and out of that chair within an hour. Because just like the patient time is important, our time is important. And honestly, trust me, I understand, because within my first year, I used to struggle with like, oh my God, this is so much stuff to do within an hour. How do I perio chart? How do I explain what periodontal disease is to a patient? How do I explain to a patient that they're not flossing correctly? How do I explain to a patient that their insurance doesn't cover this, but they need this and they don't want to pay for it? So now we're going back and forth. Like, there's so many different scenarios that I had to work through, live through, to understand that some of this stuff I'm talking about just comes with time and experience. You just have to go through it to realize, to figure out how you're going to address those situations. This topic alone, I can really make one solid video about it itself. It's so many different things I can talk about, but we're gonna cut it short right here for that, because I have other stuff I want to talk about. So to sum all of those things up that we just briefly talked about, you want to review your schedule to make sure you know what's going on, review the medical history, dental history, medication, all those things. Like I said, all those things are super duper important. Next, you also want to be aware of what patient needs x-ray, what patient don't, who needs a CCS exam, doctor's exam. We need to be aware of those things, because those things can either make or break your day, for sure, no doubt about it. And then also you need to be aware of how long it takes you to clean a patient. How long does it take you to do a pro fit? How long does it take you to do a deep cleaning? Because deep cleaning varies. If they're radiographic calculus, then it can take a little longer. Sometimes you have to do 2 quads here and then schedule them out for another 2 quads. And also, I want you guys to realize that in school we had 4 hours to clean 2 quads or 1 quad. That's not realistic in the real world when it comes to actually practicing as a hygienist. You definitely want to be mindful of how long it's taking you to clean. When I first started practicing, I wanted the patient to feel like I cared and that I took the time out to clean every nook and cranny in their mouth, every tooth, every distal, lingual, mesial, distal, lingual. I cleaned everything in sight, which I still do, but I'm quicker now. But when I first got into the office, it took me, a perio maintenance took me the full hour, and that was without x-rays. So, you know what I'm saying? Just be mindful of how long it takes you to do the actual cleaning, and then x-rays as well. If you're not quick or good at x-rays, try to get very, very acquainted with the x-rays and how to get those done quickly and efficiently, because you do not want to have to repeat x-rays, okay? The next thing I want to touch on is communication. And when I say communication, that's communication basically with your patient. You want to be able to communicate to your patient the importance of what you're talking about without making them feel overwhelmed and to a point where they feel like they don't understand what you're saying. Because sometimes as dental professionals, we can use book terms and book terminology and dental terminology sometimes, and they just don't understand it. So you have to kind of find a way to water things down to where it's like, okay, that makes sense. Or now I understand, because I've had patients tell me all the time, nobody has ever told me that. Nobody has ever broken it down to me like that. And like I said, it comes with the time. I was lucky to be a dental assistant before I was a dental hygienist. So I had the luxury of watching my dental hygienist speak to patients about periodontal disease, watching them talk to people about flossing and brushing techniques. The same with my doctor when it comes to anything. I've had the luxury of watching the way that they present treatment to people, you understand? So everybody hasn't had that. So I say to you, kind of be mindful of how you're saying things, your tone. You want to make eye contact, you want to look them dead in the eyes, you want to ask them questions, make sure they feel heard. Because a lot of times I feel like some people go in the room and they be like, okay, we're gonna do your cleaning today, and then just lean the patient back and they do their cleaning. No, you have to be like, okay, my name is Dennis, I'll be your registered dental hygienist for today. Do you have any questions for me? Are you in pain? Anything hurting or concerning? And most of the time they'll say no, then they'll say, oh, well, by the way, I have this problem, da da da. So you ask questions, you're assessing the patient. So you wanna see, okay, well, how long has this been going on? Are you doing this? Are you doing this? Has this happened since then? Da, da, da. You know, you want to figure out how to help that patient. And most of the time, the patient really appreciates that. But it's very good to build a relationship with your patients, because they're more likely to accept treatment for you. They're more likely to take their oral health seriously. Like, I have patients who, when I first met them, the gums weren't the best. They had bleeding upon probing. We had high probing depths at 5, 6s, you know. And the first time I cleaned them, we talked for a good 10, 15 minutes before I even cleaned them, which is fine because I had that allotted time. But I say all that to say that the first 2 times you see a patient won't be typically the best because one, you're new, two, you have to trust each other. They have to trust you, you have to trust them. And then once you guys build that relationship, they're more likely to accept, like I said, accept treatment, take care of themselves better, and then they get used to seeing you, and it becomes very fulfilling for me, to be honest with you. Like when I see a patient who I call it fuss at about flossing or whatever, and then they come in, they beat me. They're like, oh, Dennis, check my numbers, Dennis. Like, I got it this time. Like, they're more excited than I am sometimes. Because sometimes I have a rough day and then they come in and they make my day. So it's best and it's good to try to learn how to communicate with your patients effectively and efficiently without making them feel overwhelmed and like they just can't do anything right. You don't want to tell a patient what they're doing wrong all the time. You're doing this wrong, you're doing this wrong, you're doing this wrong. Nobody wants to hear that because I wouldn't want to hear that. The way I do it, I tell them, hey, you need to work on this. This has gotten a little better, but I know we can get a little bit better at it. Try this. Have you tried this? Have you been doing this? Are you stressed at home? Is work kicking your butt? You have to be relatable and you have to be realistic about each patient because each patient is different. I have some patients who don't talk at all. They don't say a word, but they always tell me, I enjoyed your cleaning, thank you. So, you have to be able to read the room and just go from there. Be confident, be kind, no matter how rude or nasty patients are to you, because there are some rude ones. Be kind, be patient, be understanding, be sympathetic, be empathetic, emotional, whatever whatever you feel. I really do feel like this job, this is like a all-in-one job, to be honest. You're a therapist, you are a provider, you're a hygienist, you are, sometimes you're a punching bag. Just being honest, you're all these things. But at the end of the day, if you truly love what you're doing, if you got into this field for the right reasons, because we all know the money is good, the flexibility is good, but at the end of the day, if you are in it for the right reasons, you will really have no problem with anything as far as communication and being in a relationship with your patients. So that's that one. So the next one we're gonna get into is called Ergonomics, which I'm sure we're all aware of because when we're in school, they make sure you got 2 feet on the floor, your back is up, and your neck, like this, and there's no chicken wings. We don't want the chicken wings, but truthfully speaking, when you are fresh in the office and you're trying to find your groove and how you want to do things, how you want to clean, some people polish before they scale, some people scale before they polish. I used to be the one when I first started. I used to scale, Cabotron, then polish. Now I polish, Cabotron, then scale, and it works better for me. I feel like it's probably the better way to do things. Now that I see it, how well it saves. I feel like it actually, polishing beforehand saves you time. But anyway, back to ergonomics. Not much on ergonomics, just that it's very important. You also, there's times where I catch myself doing this, when you just want to reach that one spot and you're pushed for time, you're just trying to get to it. Not saying that it's okay, but that's more so realistically how that happens. But most of the time, you want to keep, like I said, feet flat on the floor, back straight, ergonomics. You want to wear loops. I know some hygienists that don't wear loops. I'm like, there's no way you can see everything you need to see. And I know it kind of hurts their neck. So definitely get you some loops. Optics and stuff are correct to your height, how you sit and things like that. So if you're one of those students who don't have loops, please get you some loops. It will make your life 10 times easier and your cleaning's 10 times better because you can see every little thing. So when I first started working as a hygienist, I worked 5 days a week. I don't know why I did that. I just was so excited to be there and I wanted to make all the money I can make, right? The hygienist that was at my office when I was assisting at the office, she told me, Dennis, you're gonna do great. Just make sure you work 4 days a week because 5 days a week can be a lot. I'm like, okay, I hear you, but I didn't understand her. So fast forward, I get my license, I'm working 5 days a week. I started to notice that I felt like I was very overworked. I felt like that my body could not handle it. The ergonomics wasn't even that bad for me. I think it was just doing this 5 days a week is a lot. And sometimes I do stand up and I do sit down, but 5 days a week was a lot for me. I'm not telling you guys how many days to work, but some people can handle it, I could not. I started to notice that I was having back pain. Like when it came to getting off of work, I would just come home and lay on the couch and just stretch my back out, or I would just lay on the floor because my back was hurting so bad. And it got to the point I couldn't even work out in the gym because I had so much tension and pain in my back, and eventually it went to my neck. I'm like, oh my God. So I went to doc, I was like, hey, I want to cut down to 4 days a week. And then I started going to get massages at least twice a month, which I'm actually due for one now. But getting massages, stretching before and after work is very good. Those stretches that you guys used to do in school, I don't know if you did them, but we did stretches where you touch your toes, you know, crack your back a little bit, all those things, rotate your neck, exercise your fingers. Those things are important because even working 5 days a week, I noticed that I'm a left-handed dental hygienist. My left hand was getting kind of tight, the fingers were popping. Like there was a lot of stuff going on. So I'm not even a year in and I'm feeling all this pain, like this crazy. So I cut my days down to 4 days a week. I only work Tuesday through Fridays. Fridays I work 8 to 2 and then I'm off. I'm off on Mondays, so I'm off Saturday, Sunday, Monday. I go to my massages. I do the little hand exercises when I'm not working. You know, I try to keep everything nice and oiled up. I try to be a nice, well-oiled machine so that I can be the best me at work, because ergonomics is very important, you guys. If you want any type of longevity within this career field, you need to definitely get massages, take those days off, take that vacation. Sometimes you want to just like, I wish I could tell you guys everything. I really do, because within this first year, I've learned so much about myself and the type of hygienist I want to be. You want to prevent burnout as much as you can. Take care of your body. Your body is a temple. If your body's not 100%, you can't be 100%, okay? So the last thing I kind of want to touch on is the workplace dynamics. And what I mean by that, that's your relationship with the dental assistants, the doctors, the office managers, and the healthcare coordinators that work up front, like the ladies that schedule and do the financial part of things. Like your relationship with those people are very important, because you just gotta think about it. We all are a piece of a puzzle that comes together to give a great patient experience and make sure the patient gets what they truly need and want, okay? Okay, so let's talk about diagnosing treatment together with your dentist. You want to be on the same page because they can cause friction between you, the dentist, and the patient. Like, let's just be honest here. So you have a new patient, the assistant goes in, take the x-rays for you, assist the patient, come grabs you if you probe. You go over the x-rays, you go over what the numbers mean, you go over all the different types of cleanings, like you do your big one and you explain everything to the patient. And you go to the doctor, hey doc, I just probed, talk to the patient, whatever treatment, I diagnose a gingival scale, right? Everybody knows, as a hygienist, you should know that gingival scale is pretty much means gingivitis, bleeding gum. Not too bad, you have some fours here and there. By fours, I mean 4 millimeter pocket. No, it's not quite yet SRP, but it's kind of on its way. And then your doctor may go in behind. She may say, oh, he or she may say, okay, cool. And then you may go on about your day and see your patient that you're scheduled to see. And then you may come back around and they may say, oh, the room that you went into is now SRP. And you're like, well, it's not an SRP because I probed and my numbers read, my assessment came out to be a gingival scale. So at that moment, you guys have that issue. The first time you have that issue, please address it right then and there, because there's some type of disconnect. You and that doctor, y'all both are providers. You need to have some type of conversation to come to a middle ground of why that he or she said this and you said that, because something is off. You guys need to kind of calibrate and get on the same page. I kind of had that happen to me. I went back and forth with the doctor. We talked about it. Like I said, some doctors, all of those are different. All doctors are different. I have 2 in my office and they're kind of same, but they're kind of different. Some people diagnose based off of bone level. Some people diagnose based off of probing depths alone. Some people do both. I do both. I do probing depths and bone levels. Because you can have somebody that has some bone loss, but their numbers may be solid. They may have maybe a couple of 4s here and there. They may have 3s. If they're a new patient and it's their first time coming to you, then that means that whatever they had previously, from whatever practice they came from, is under control. And when they come to your office as a new patient, you now have to treat them at the level that they met you at. You can't treat them as something that happened months ago. So I had that conversation, and now we're calibrated on the same page, so everything's good. But please, never be afraid to stand up for yourself when it comes to diagnostic treatment. Never be afraid to stand up for yourself in general when it comes to anything relating to you. Never let an office manager, a dentist, an assistant, either other older hygienist run you out of a place or run you over or try to make you feel like you don't know what you're doing because you're newer, okay? Just be confident, stand your ground, and believe that you are a licensed registered dental hygienist. I'm sorry, I went on a tangent because I feel so passionate about that because I had that happen to me before and I did not like that. But yeah, back to what I'm saying, workplace dynamics. So that's one way that you and a doctor can have the workplace dynamic with your assistants. Be nice to your assistant. If you have a dedicated hygiene assistant, treat them like you would want to be treated. Don't be lazy, clean up after yourselves, have great leadership skills, be kind. Don't just don't treat them poorly is all I'm saying. Do not treat your hygiene assistants poorly. I've never had a hygiene assistant, but I do have assistants that, you know, me and the doctor share. My assistants at my office mainly cater towards the doctor, so me and Jasmine, which is the other hygienist, we do 95% of our stuff on our own. We flip our own rooms, we do our own x-rays, we do our own perio charting. But sometimes when we can't do all those things, we do ask for help, and they do try to help us out. So always have a good relationship because they can either make or break your day. Because if your assistants hate you and they don't like you, you will have a hard time at the office, and that's, guys, honest truth. I haven't had that experience, so but I've heard people horror stories about those type of environments. So definitely treat those people nice. And as far as your office manager, same thing. More of the story, treat everybody how you want to be treated if you were in their position at that job, you know what I'm saying? So I hope you guys enjoyed this video, man. I really tried to give you guys some of the things that I've learned within the years working as a licensed registered dental hygienist. But there's so many different things I want to touch on, like my brain was just going. But I hope you guys kind of got something from this video. If you want me to make a part 2, I can. I have plenty of tips and thoughts about certain things I've learned within the first year of me working. So just let me know. Once again, my name is Dennis Walker. I am a licensed registered dental hygienist here in Atlanta, Georgia. And these were things I've learned as a first year dental hygienist. Hopefully I can make your first year as seamless as possible.